And welcome back. As consumers struggle to navigate another heavy hitting cold and flu season, important to uncover the misconceptions surrounding the alarming overuse of antibiotics, especially the misuse in treating viral infections like the common cold and flu. Join me now in sharing more to help us and help all of us, I should say, safely and effectively manage cold or flu symptoms is Dr. Ken Redcross. And Dr. Redcross, thank you so much for being with us.
Hey, Darren, how are you? Thank you so much for having me on today.
Appreciate you being with us. And I'll start by asking the question about how prevalent is it when we talk about the misuse of antibiotics in a household?
Yeah, look, when we learned recently that when antibiotics are used inappropriately, it increases antimicrobial resistance. So just last year here in the United States, 2.8 million infections were resistant to antibiotics. And unfortunately, Darren, 35,000 people died because they contracted these infections that were resistant to antibiotics. But the silver lining is this, that we've decided to focus on urgent care centers. One study showed that in urgent care centers, 7 in 10 people ask for an antibiotic during this time of year, which is not what we want to do.
When we talk about antibiotics, we look at it and we do some self-diagnosis, right? A lot of people feel as though, I can deal with this when it comes to the cold and the flu. But the reality is not so. We talk about bacterial infections, something different.
Yeah. Yeah, this is the important thing to remember, everyone. So we're living in the cold and flu sort of season right now, and it's important to understand that antibiotics are not effective. But why? Because we know that bacteria have cell walls and antibiotics attached to the cell wall. Viruses don't have a cell wall. So there's nowhere for an antibiotic to attach to. That's why it's ineffective. So when you're looking at things that are really going to make a difference, you need to look over the counter. I like Mucinex for my patients because I know that Mucinex is not going to contribute to antibiotic resistance, and I know it's really going to provide that relief that we really need as far as the symptoms that we have during this time of year.
And when we look at the consequences, people don't really
Yeah.
recognize the full breadth of the consequences that really are associated with this. So, what are some of the potential consequences that you're seeing people face and have to deal with?
Yeah, look, some of the statistics that I mentioned before are the consequences that we're actually living. Think about these. Me as a practicing physician, certain antibiotics I can't use because of resistance. I have to sometimes go to IV antibiotics. The importance is to recognize that there are things right at our fingertips over the counter that can make a really big difference this time of year. I mentioned Mucinex because what we're really dealing with are high mucus counts, right? Or issues as far as with secretions and phlegm. Mucinex helps to break that up. It's a mucolytic that helps with the cough and the congestion, and I don't have to worry about contributing to this antibiotic resistance issue that we're having.
And when we talk about this idea of antibiotic resistance, obviously we know it's becoming more and more prevalent in American households. But talk to me from the public health perspective. What's it looking like in the public health perspective as these numbers continue to rise?
In the public health perspective, it's becoming a little bit of a challenge. But I'll tell you, this campaign that I started, I partnered, as I mentioned, with the urgent cares and primary care centers and Mucinex for this campaign that we call Flip the Script. It's here so that we can all get educated on wonderful shows just like this, so that we flip that script and recognize there's no antibiotic necessary here. Now, you do need to talk to your doctor. As I mentioned, we're all different, but we're definitely able to come around and say, look, what can we do to change what's happening in the United States right now?
And there are some educational initiatives that are actually out there that really help people to become better educated, to know exactly what to do. I think when you talk about public health, education is always the best medicine. So give us a little bit about that.
Absolutely. Education is always the best medicine. So hopefully today we're all educated to know that antibiotics are not going to help during the cold and flu season, and also educated to know that our doctor still needs to be a part of that. Now, look, we have some wonderful information about this campaign called Flip the Script at mucinexfight.com with a lot of wonderful resources so that we make sure, as you mentioned there, Darren, during this public health sort of thing, education is knowledge and key.
Yeah. Dr. Redcross, talk to me a little bit about over-the-counter products because a lot of us are very familiar with over-the-counter products. It's what we do.
Yeah.
We want to get those over-the-counter products to really fast diagnose and hopefully get through what we're going through fast. But then when it comes to antibiotics, that's a different kind of story. So let's weigh it out here. Over-the-counter products, antibiotics.
Yeah. So look, like I said, during this cold and flu season, antibiotics should be way over to the left here, Darren. And as far as the things that are over the counter, one of the challenges I find, and why another reason why I like Mucinex that helps, it has guaifenesin, so it helps with those secretions to help us with the phlegm. So many of the other over-the-counter remedies are a little bit of a challenge because they have other things in them that patients may not know they're already taking, such as Tylenol and things of that nature. Tylenol is great for what it's necessary for. I'm just saying that lots of times when you're getting over the counter, people don't always know that some of the things they're taking here and there all have some of the same things. I don't have to really worry about that. Typically, when I have my patients and we're talking about Mucinex and the benefits of these horrible congestion that we get during this time of year when we come down with the cold or the flu.
So what is the optimal way of really dealing with cold and flu? So many of us are dealing with it and want to overcome it. I think that's the thing. People look at it and say, I want to get past this as fast as I can. And they think that by taking an antibiotic, it's going to be the first line of defense, but it's really not. But what are some of the best ways to manage cold and flu symptoms?
Well, look, there's a couple of things. I'll give you one beforehand, Darren, which is, of course, talking about the importance of hand washing. There are some wonderful studies everybody may not recognize, but that can keep us from getting it in the first place. Now, to your direct question of when you get those symptoms, it's those things that our mom always told her, our mom and dads, right? We need to make sure that we're getting the rest. And I also talk a lot about keeping down the S word. The S word for me, Darren, is stress, because those are the things that really impact us all year long. But especially during cold and flu symptoms or cold and flu season, it makes us more susceptible, and we need to be careful about that.
A lot of people won't think about that S word, stress. I really didn't even equate that in the equation, but it's really real, huh?
Yeah, it affects your immunity. We know this already, that, on some of these days, or even when you don't get a lot of sleep, it takes one sleepless night to really have a problem. When you wake up the next morning, your nose is running and that sort of thing. It's because it's about the immune system and making sure that we support that the best way that we can. And we can do that with making sure that we're getting enough sleep and keeping down the S word as well.
Well, we're going to keep the stress down as much as possible. Dr. Redcross, before we leave, final information you want to share with us?
Sure, everyone. So once again, flip the script is the importance. Antibiotics not necessary during this time, but once again, there is wonderful information at mucinexfight.com. Please go over there and learn even more about what we talked about today.
All right, Dr. Redcross, thank you so much for being with us, and appreciate really the understanding, because for so many people out there trying to self-diagnose, trying to deal, but you set the record straight, and hopefully in 2024, we'll take better care of ourselves. Thanks so much.
Absolutely. Thank you for having me on. Be well, everyone.
All righty. Well, listen, again, if you want more information, please visit the website at mucinexfight.com. Encourage you, don't go anywhere. We'll be back with more Open coming up right after this.